Rosecrans provided psychiatry for the community for many, many years. And then the state changed the way it was going to fund that, basically taking away 3/4 of the funding that was supporting that program. And we get paid a little differently, we can bill a little differently, which allowed us to take on the program. We lose a little bit less money, and with United Way and Mental Health Board support, we're able to keep that program going. On this issue, we came to United Way when we had to move quickly. We just had a couple of months to make a decision and execute taking on the program from Rosecrans. And taking on a new program has startup costs that we were not going to be able to recoup. And so we requested money for technology, for training, for the transition that allowed us to be able to take on the program. And so now patients can still go to the clinic they were going to, but able to see their psychiatrist and their nurse and get the care that they're used to and that they need.
And that was really important, since we had this collaboration, that we tried to make for the patients as seamless as possible. We didn't want them to have to go to another location, maybe see a different provider, a different nurse. And so I think in what was potentially one of the worst case scenarios we could have been facing as a community, it was probably one of the best situations from, I think, the patient's perspective, that it was seamless and they could still see the same people. And so it was really easy for them to continue to get the medication that they needed and continue to live their healthy lives that would have been drastically different had this not happened. We could see probably all kinds of potential negative consequences had we not been able to continue with the psychiatry services. Individuals might be finding themselves in the emergency departments more often, perhaps maybe getting involved with criminal justice problems. You might even find people moving towards homelessness. These are typical things that you might see in the homeless population. More health concerns, just general physical health concerns, can happen when you have somebody who is not able to get the medication they need for their mental health condition.
So 1,200 people are able to live healthy lives, meaningful, healthy lives that might not have been possible if we weren't able to execute this collaboration. To lose access to your psychiatrist and access to the medications that are keeping you healthy, it would have been devastating. So we're really lucky to be able to have worked that out with the help of United Way.